Hello friends, only 6 days are left for your INI-CET exam and most of the students are confused what to study. Should I solve the MCQ or should I revise my weak subject? In this video, I will tell you what you should exactly do in the last few days. Because in these last few days, your strategy matters more than studying the new things. So watch this video till the end because one wrong strategy can affect your rank in the exam. So right now you don't need more books, you need smart revision plan. So I will tell you exactly how you will study. So in the last few days you have to follow the priority schedule and you are already doing your revision. So goal for the last few days should be maximum recall with the minimum stress. So let us discuss first what should be your key revision resources. Your key revision resources should include a compilation of recent updates from the last 2 years, and the specific sources include AIMS, PGI, and JIPMER websites. So from these resources, you can expect about 10 to 15 exam questions. Then high yield mnemonics. To prevent silly mistakes on recall heavy topics in all the subjects, you must have made certain high yield mnemonics. So that you should specifically revise during these last few days. The PYQ in the last 5 years that constitute about 20 to 30% of your questions in the exam. So from this PYQ, you can analyze the style of the clinical vignettes case study rather than just the answer. Now, clinical vignettes include scenario which are provided with the history and examination results before asking you a specific question. So this type of the questions are most of the time asked, and certain volatile tables, for example, immunization schedule, developmental milestones in pediatrics, IPC sections in the FM, and drug of choice in pharmacology. This type of the volatile tables you must revise before your exam. You should follow a weighted approach. And what is this approach that we will see? So you have to follow a strict timeline to cover all your 19 subjects during these last few days. The major subjects, if you are revising, then it can really make your score high. And these include medicine, gynae, surgery, pathology, pharmacology, biochemistry, and microbiology. This you should allocate at least 4 to 6 hours for each subject. Then moderate subjects include anatomy, physiology, PSM. For this subject, you have to allocate at least 3 to 4 hours. And for the least weighted subjects, you can spend at least 1 to 1.5 hours. Pediatrics is one of the highlighted subject with the 18 question in the recent papers of last 2 years, and priority should be given of at least 4 to 5 hours. Now talking about the question trend, last few years, high focus on clinical case scenarios, image-based questions, and multiple medication scenario type of the questions are asked. So you have to focus on this type of the questions. Now coming to the high weighted subjects, and this can really boost your score. So according to the last 5 years, from medicine, 18 to 25 questions are asked. And these include cardiology, endocrinology, nephrology, neurology, and infectious diseases. From this area, the questions are asked. So in this section, patients with hypertension and diabetes, this type of the clinical case based scenario questions in the form of the MCQ can be asked. From surgery, about 12 to 18 questions are asked, and these include general surgery, orthopedics, and surgical oncology. Orthopedic questions are usually challenging, and these are usually memory based. So you have to remember the classification systems and management algorithms. In gynecology, 12 to 16 questions are asked, and these include high risk pregnancy, labor management, and gynecological oncology screening type of the questions. Now another high weighted subject is pharmacology, which include 12 to 18 questions, and these questions are usually from drug interactions, adverse effects in certain special situations, for example in pregnancy or in liver disease or in the kidney disease, and questions based on the mechanism of action of drugs can also be asked in the exam. Pathology, 10 to 15 questions are usually asked, and these include identification of the histopathological images, tumor markers, and classification of the hematological malignancies. Biochemistry, 10 to 15 questions are asked, genetic disorders, metabolic acidosis, alkalosis calculations, CRISPR, and tumor genetics, molecular and DNA technology. From this area, the MCQs are asked. So these are your high weighted subjects, and you have to revise all these subjects to achieve great score in your INI-CET exam. Now low weighted subjects, these are your hidden rank boosters. So these include psychiatry, FM, ENT, ophthalmology, dermatology, anesthesia, and radiology. From each subject, at least 3 to 8 questions are usually asked, and collectively they comprise about 15 to 20% of the paper, and that is the major game changer. The fact about this subject is it is easy to score and the questions are usually uncomplicated. The syllabus is insignificant. You can score 20 to 25 marks in just 2 to 3 weeks of intensive study. So since 2024, psychiatry has gained more significance, and questions about the screening instruments such as the PHQ-9 and HAM-D score, some of the popular medications like SSRI, which is commonly prescribed for depression, and how to manage psychosis, this type of the questions are usually asked from the psychiatry. From radiology, image-oriented basic questions on the CT scan, MRI scan, and X-rays are usually asked. So you have to cover all these low-weighted subjects also, because these are usually your hidden rank boosters. Now coming to the most important part for the exam strategy, and that is your last 5 days priority schedule. So this starts from May 10 to May 14, and this timetable I have designed in such a way so that you can cover all the 19 subjects from 7 to 10 p.m. and plus suppose if you are sleeping at 12, then you will have at least 2 hours after completion of this schedule also. So that means during that time, if you are having certain other topics to revise, then you can easily do that. On May 15, you can revise some of the high yield topic or the volatile topic. So that day I have kept as a reserve day. Now coming to the strategic advice for your revision plan. If your current revision notes are bulky to complete within this 5 to 7 days, then switch over to more concise source. Don't ignore images. 30 to 40 questions will be from the image, and spend at least 1 hour daily for image question bank. Drug adverse effects, peripheral blood smear, histopathology slides, X-ray, CT scan, ECG, fundoscopy images, and dermatological photographs. This type of the image-based questions are usually asked, and that will be definitely in your INI-CET exam also. Extended matching type of the questions, where you have to match one of the option with the correct answer, and assertion reason type of the questions will be also asked in the 2026 of May. So you must revise this type of the questions, or you must practice this type of the questions. During the revision, active recall is required rather than the passive reading. Cover the page and try to recall the table contents or the mnemonic, just like new drug update part 1 to 6 videos which I have already uploaded, that you can again revise for your better retention. Practice alertness. Do your heaviest revision during the actual exam hours, that is from 9 a.m. to 12 p.m. to train your brain to be at a peak alertness during that window period. Now coming to the common mistakes to avoid in the last week. Most of the students do this mistake often, and that can affect your rank negatively. Watching too many last moment revision videos can affect your rank. You should stop starting new topics. Focus entirely on consolidating what you already know and fixing your volatile memory. Some of the students revise entire marrow or prep ladder again during the last few days. This type of the mistake you should not do. Don't be panic and try to solve more than 300 or 400 MCQ in a day. Ignoring weak subjects or low weightage subjects completely can be again your mistake, and it can affect your rank. Majority of the students become anxious and they tend to delay the sleep cycle during the last few days of the exam. So sleep is non-negotiable. Don't do this mistake. 7 hours of daily sleep is essential to boost your memory and to boost your alertness during the exam. Eat healthy home cooked food. That is essential to maintain your health, and don't compare with others. Trust your preparation and stay confident. So these are the common mistake which most of the students commit, that you should not do during the last few days of the exam. Now coming to the exam tricks and tips. These tips are very essential to follow, and these can really boost your rank. Now the difference between the 5,000 and 50,000 rank is mindset and avoiding the silly mistakes which is caused by the mental exhaustion. The safe zone is you have to aim for 140 to 150 correct answers. To secure desirable seat within 2000 of rank, you have to give correct answer of at least 170 to 185. If you try to guess randomly over 15 to 20 questions, then it can be detrimental to your score. So don't do this type of the silly mistakes, because INI-CET is having a negative scoring system. INI-CET is having a negative one-third marking for each wrong answer. Aim for high accuracy. 180 plus correct answer are usually sweet spot, but do not force it if you are not sure. Now, how you will manage the examination? Most of the students think that I have forgotten everything. So it is normal to feel like you have forgotten everything, and that is just because your brain is in the pre-exam anxiety. Once you see the options on your screen, your subconscious memory will automatically kick on and you will click immediately the correct answer. So trust your gut and your preparation. So in your exam, you will be having 200 questions and you will have only 180 minutes. And these questions are usually divided into 4 sections. Each section has 50 questions and 45 minutes to complete. So there is very less time. Don't waste too much time on one MCQ and maintain speed from the beginning. So you will have only 1 minute for one question. For example, if you are not sure what is the correct answer, then you try to tick mark the most possible correct answer and then you review when you have the time. Keep last 5 minutes for quick review of a section. To manage time, you have to do just practice, and that practice will make you perfect. Read last line of a clinical question first, and that will usually save your time. So these are very important strategic tricks and tips to crack INI-CET exam. Accuracy, calm mind, and strategy, these are the key to achieve better rank in the exam. And remember, these last few days are not about studying perfectly or revising everything, but this is about smart revision, fast recall, and staying calm during the exam. These are the key to boost your rank higher in the INI-CET exam. So even during the last few days, your strategy can significantly boost your score. So stay consistent, stay confident, and keep revising smartly. All the best to my future doctors for the INI-CET exam. Thank you for watching.